into the world of endurance, strength, and the occasional flip and fall moments in sports.
It's a long journey. It's again a mixture of emergency medicine, orthopedics, and many other departments. So I love helping patients, educating them, speaking to them about what are the pros and cons of.
Hello and welcome to the podcast Hats Off by Ranjith.DBalasubramaniam, RBS, that celebrates extraordinary achievements in various fields. In today's topic, we would like to discuss about sports medicine, the podcast where we dive headfirst into the world of endurance, strength, and the occasional flip and fall moments in sports. We welcome Dr. Vishnu, sports and exercise medicine specialist at Optimal Clinic, Alras Medical Clinic in Dubai. Also, he serves as the Chief Medical Officer for United Arab Emirates National Olympic Committee and Rugby Football Club. Initially shadowed Derby Country Football Club, Derby, United Kingdom. Welcome to the podcast, Doctor. Thank you very much for accepting our invitation and coming and joining this podcast. Can you introduce yourself with your background and on sports medicine, and how did you become interested in this sports medicine field?
Firstly, thank you for your introduction. It was very nice. My name is Dr. Vishnu, and I'm a sports and exercise medicine physician at Optimal Clinic and at Alras Private Clinic, Dubai. I also recently joined as a Chief Medical Officer for the United Arab Emirates Olympic Committee, and I also am a team medic for Exiles Rugby Football Club, which is based in Dubai. So I'm born and raised in Dubai, but my origins are from India. My mom's a doctor and my dad's a chartered accountant, and everybody is based in Dubai. So I did my schooling also in Dubai, and it all started from a very young age. I was very athletic and I was into sports. I was an athlete. I still consider myself as an athlete. And I used to take part in a lot of athletics and athletic events, such as 400 meter, 800 meters and upwards. And I sort of thought this would be my life since then, because I was so much into sports where I thought I could be a sportsman. I did have the caliber of pursuing sports as my career, but then I had to step back, because there is a certain period where your body can only stay as a sports person, but then after that age you're pretty much having a regular life. So that becomes a challenge, what you're going to do after that sports life. And not everybody is a Cristiano Ronaldo or a Lionel Messi, or a LeBron James. So you kind of have to know exactly what to do and how to go about it. So it all started with my father giving me that advice, saying, if you want, you can combine sports with medicine, so that you're kind of carrying your own passion along with that. And I kind of sat and thought about it, thinking, yeah, that's a good idea actually. So I have my field with me, and I'm also doing something which I can pass it on to. So I love helping patients, educating them, speaking to them about what are the pros and cons of getting into sports, and what are the injuries you can sustain and how that can impact your sporting life. So I think that was a very good decision then, and I've been pretty much into that for a very long time. So even after my undergrad, I had to sit down thinking, okay, whether this would be my future or not. And then you have to take the risk, really. So I took the risk and I'm benefiting the fruits out of it.
Wow, that's really inspiring, doctor.
Thank you.
And doctor, sports medicine has become a very popular subject last 10 years.
Yeah.
Actually, what is sports medicine and what does it encompass?
Okay, so sports medicine is a very new department. So it's actually a mixture of emergency medicine, orthopedics, and rehabilitation centers. So you have your physiotherapy, nutrition, sports and conditioning, and many more departments under that. So as a sports medicine physician, you are looking after everything, all the aspects of it. So you are basically in a multidisciplinary team whereby you are managing your team or the individual you're taking care of before they compete and after they compete. And also you kind of work along with different departments and come with a unanimous decision whether or not to allow the player to move forward with the sport or not. So you're basically like a middleman between the coaching staff and the medical staff and the higher stakeholders. So you're seeing three dynamics over here. It's more holistic approach to the player, so you're not giving them just a one fix for everything. Rather, you're taking decisions from everybody and you come out with a final conclusion, and then you're guiding that player towards excelling in their sport. So even if he's injured, you kind of make a plan and you regulate the plan, and then you stick to that protocol and communicate with the patients and your supporting staff members. So everybody is on track that way. You also look at different aspects. So you're looking after not only their physical health but their mental health also. So you're mixing a little bit of clinical psychology, and that's really important for a player because most of the time they have game stress, whereby you're having pressure from your fans, you're having pressure from your coaching staff, your managers, and that can hamper the player's performance. So you as a medic kind of give them positive affirmations saying, right, you can do better, you can do best. So then they feel boosted up and then they excel in their sport.
Okay, doctor. Great. How do you approach the treatment and prevention of injuries? Tell us something about the common injuries, sports injuries that you come across.
So most of the injuries that happen in sports is related with orthopedics, but you're also looking into the musculoskeletal system. So you're looking more into the strains, the sprains, your muscle tears and tendinopathies. So if a player, for example, if he's into athletics and if he's a 100-meter runner, so he could probably have a partial tear of his groin and muscles, and which is very common because it's an explosive movement. So you're using all your groin muscles as well as your hamstrings and quadriceps. So they get overused. So because of that, there are chances of having partial tears. So once that happens, the doctor gives the initial assessments and diagnosis and sits with the player, tells him, right, this is what's happening, this is what we can do, and you kind of have to educate the player then, saying if you are going to push more for your next events, chances of having a complete tear is more risky and it's more significant. So you do have to take care of yourself, you have to rest well, and you give your conservative treatments. You also have to work with, say, if there's a ACL for that matter, if you have an ACL injury, You do have options of whether to do surgically or non-surgical treatments. Most of the athletes, if they are elite athletes, they would prefer to go for surgical treatments because they have to get back on the pitch, and that is pretty much what the coaches and the managers would want. So as a medic and as the medical team have to work together then, trying to get him back on track within a limited span of time. So that's where you have to really work very efficiently, and you should be right up to the mark, whereby you don't really have to think about what's going to happen in the future. You do have an idea of it, but you want to minimize that injury. So there are a couple of few examples there whereby we had one athlete, a rugby player who had 3 ACL tears, and he had done his surgery 3 times, but then it kept recurring. So as a medic, you would want to tell him that the chances of having more injuries are way too high, and if you keep doing it over and over again without the proper rehabilitation process, it's just going to build up to osteoarthritis when you hit your 50s and over 50 years of age. So it all comes down to patient education over there, and having the right set of protocols to be followed. Yeah, then the patient will be fine.
Okay. Doctor, risk of injury, especially the serious injuries like fractures, can occur in this contact sports like rugby and football and all that. So before choosing those kind of sports, if there is any advices need to be taken from a sports medicine specialist, is it whether their body is perfect enough to take up that kind of a sport?
So when a player wants to get into a sport, we usually do a pre-assessment before the games, because we want to know if they have any preconditions, if it's related to their lungs or their heart, or if they are diabetic, or if they have any sort of illnesses beforehand, so that during the competition, if anything happens, the medical team knows what to do next. So they are well prepared and well equipped to follow up with the patient or with the player. Now, if usually what we do is we kind of give them a pre-assessment forms whereby we do screening tests. So we do certain tests for their lungs, such as we do a VO2 max, which is checking the oxygen consumption level of the player. So from there we can come to know exactly what's the baseline, how much they can push, and whether as a personal trainer could push more and help them to breathe better. Then there are a couple of screening tests for the heart as well. So we do ECG, which is electrocardiogram, whereby you put in your leads and then you're checking if there's any sort of abnormality in their ECG. So some of the athletes do have certain issues and abnormalities in their ECG readings. So that gives us an idea of whether or not the athlete is fit to play, or whether there are alternatives to combat this problem. So because recently now we've got a lot of players having sudden cardiac arrest, especially in football that happened in the World Cup, whereby one of the Denmark players, Christian Eriksen, had a heart attack, and he was on the ground, and the medic staff knew exactly what was going on. So they ran onto the pitch, they did immediate care, and then they took him to the hospital then and there itself. Whereas a few years ago, there was a Nigerian player who passed away on the pitch because they never had that kind of a medical care. So as and when the years go by, the medical teams are pretty much updated on how to tackle such situations. And with that situations, you want to do these screening tests to prevent such problems. So So as a physician and as a medical team, we kind of assess all of this. Some of them we also do with nutrition, so we send them to the nutritionist. The nutritionist is the one who analyzes and comes up with a diet plan which suits the player, whether if it's an individual sport or if it's a team sport. So it makes it easier for everybody to follow. And we keep following up with them in every 6 months or probably after a year. So we kind of have a baseline pre-season, and then we check post-season, which is usually end of April or end of May. And then we compare both to see if there's any changes happening. So if there are any changes happening above their baseline, then we would try to sort a management for that. But if there's no changes, then pretty good to go. Then they can go on to the next season.
Okay.
So, yeah, it's a seasonal thing.
Oh, okay. Doctor, now parents and children are worried about growth and development, as a result of injuries, especially the bone, development can be affected.
Yes.
What's your opinion on that, doctor?
So, adults and kids, that is especially the age of 12 years and above, their bones are growing. So, when their bones are growing, you have growth plates basically between your bones. So it really depends on what sport the player actually wants to play. Now, if it is a combat sport, there's no issue, but you are susceptible to having injuries throughout because it's a combat sport, so you're putting your bones at risk. So having a right diet plan and having the right exercises to follow would strengthen the bones. Now, the parents and the family members don't really understand this part of it. So they kind of think, oh, my son or my daughter might play this kind of a rough game and they're going to have this injury, that injury. Any sport is going to give you injury, regardless of whatever sport you choose. But then it's just depending on the right food you eat and the right mentality the player has. So giving them again positive affirmations and supporting them throughout their sporting career would be really nice. And even with family members, they have this issue where they say that he or she might be eating a lot of food, and especially with the women, they have a lot of issues with body image. So if they say, oh, I'm going to have a lot of carbohydrates and that's going to affect my body image, I might look in a different way, it's not really true. So that used to be a stigma before, whereby most of the women thought that, oh, if I eat a lot of carbohydrates, I'm going to put on weight. But that's not true. That's actually a fuel for you to perform better. So having the right diet, again, if you're having a balanced diet of protein, carbohydrates and fats, your whole body system works efficiently with lesser injuries. Whereas if you're having just minimal foods and you exert a lot, you are about to have a deficiency called relative energy deficiency, whereby your body doesn't have that much energy to push you throughout. So you're exercising way too much, but your food intake is less. So there's a issue with your hormonal balances and your bone structure becomes weak. So you're more prone to injuries. You feel very tired, lethargic. You feel very fatigued, and you kind of don't concentrate well. So you do want to keep your food intake and your energy expenditure equal. So I think parents should understand how that works. So if you're going to your physician or your consultant, have an idea of how this works before you send your child for any sport.
Doctor, now when it comes to the people who are engaged in national level sports, who represent the country, and when they come across any sports injuries, rehabilitation and the recovery process has to be more faster than the other normal sportsmen who represent the domestic level, because they are not in a position to take long time rest or something like that. So, but in the re-injuries, the possibilities of re-injuries also can come if they are not properly rested. So, what's your experience and what do you want to say about it, doctor?
So, when it comes to a sporting event, so for example, if it's a big sporting event like an Olympics or the World Cups or your Wimbledons, the thing is you have the best of the best medical team ready for you. So the player doesn't have an issue with thinking of their medical health as such, because when you have a medical team who knows you in and out, it doesn't have to worry the player. So the main idea for the player is just to win trophies and medals. They don't have to think about this section of, oh, I'm going to get injured, and if my leg is going to twist, what am I going to do next, and all those. That's where again your clinical psychologist comes and enhances your performance mentally, because most of the games, especially when you consider the top athletes, they have a clinical psychologist whereby they can pretty much enhance their performance, giving them ideas and visual thinking about how to win a competition and how to stimulate certain neurons whereby you feel empowered, and they feel like the athletes also should feel little more at ease rather than having the game stress on. Now, when you said about the injuries, so if a player does get injured during the sport, you kind of bring the player outside the pitch and then you're doing your quickest assessment possible. So you should be really sharp with your diagnosis and how quickly you can fix, what are the protocols that you've studied and what you've done it with your colleagues. So that's where your whole multidisciplinary team works. So say for instance, there's an example, if Cristiano Ronaldo has a hamstring problem, so the medical officer of that team would pull him out, give him the quickest recovery possible, but then he would also educate him saying, if you're going to push now, it's going to get more worse. So you do want to rest it, and it is going to be a bad news to break, but it's for the betterment of the player. Whereas if you just push him saying, okay fine, I'll do the quickest recovery possible for you, and if he gets re-injured, it's just going to reduce his performance, and because of his high stature, it just makes it more worse. So it affects his whole career, his financial career, all of it. So there are certain things where you would want to understand before you commit. So understanding that part is very important, and that's where education is, especially educating the player, because the player has no idea what's happening medically. So building up that rapport is very important as a doctor. So the more comfortable they are with you, the more open they are with you. Whereas if you really don't open up to them, or if they don't open up to you, it's going to be a problem. There might be certain situations whereby they'll say, oh, I had this injury like a couple of months ago, a couple of years ago, but then I've just forgotten about it. Then the doctor or the physician, whoever is there, would be saying, why are you saying this now? Like, why didn't you tell me before? So if the player would be like, oh no, I was too scared, because if I did tell you this, you might pull me off. So that's where it becomes a very tricky part for the doctor to say, right, do you want to play or do you not want to play? But again, it all comes down to your diagnosis, whether it's quick enough to understand if it is serious or not. If it is serious, you have to pull them out, regardless. I mean, after all, you're looking at the player's welfare, not his stature. You want him to be as normal as possible before he gets into his next competition, and you're kind of avoiding the re-injury aspect of it. So you do want to reduce that part. So education is the key. It's one of the most important things that most of the sports physicians do. They educate their players, they make them understand, and then they give them a set protocol whereby it makes it easier for the player to just follow, rather than just going to a random person or random physician who has basic ideas just to give medicines and finish it off. So yeah, I think education is the main key over there. Coming back to the rehabilitation process, you would want to follow up with your team again. So you have your physiotherapist, you have your strength and conditioning coaches, you've got your sports therapists, and your psychologist and nutritionist. So you're working with all 5 of them. So having a follow-up with them every month would be better, so you can kind of see the progression happening with the player. So there is a protocol for different injuries. So we kind of follow a graduated return to play protocol, whereby it's a 4-stage process, and each stage you're monitoring the player. So say in stage 1, he's just going to walk at a normal pace. So after a few days, you're calling him back and then you're assessing again. So if he passes that test, then he progresses. But if he fails the test, then he has to repeat it again. So it's very strict in that way. So again, it's just for the betterment of the players. So they also feel comfortable. They have a goal to reach. So they would feel more challenged, and they would feel like much more better mentally. They feel mentally stronger also. So each stage they have to clear, they get their tests done after each stage. If they pass, then they go to the next stage. If they fail, then they start from stage 1 and go upwards. Another thing is to do with head injuries and concussions, whereby it's more scrutinized. So you do a baseline test, and then you send them for the return to play protocol, and then again you're continuously following up with the patient for these tests. And yeah, it makes it comfortable for the player, and they feel more closer to the physicians and the whole medical team, and they feel more relaxed for their games to come forward.
Okay, doctor. Doctor, impact of an injury on their self-esteem and their psychological well-being.
Yeah.
It's going to play a major role after their recovery also, the physical recovery. How do you deal with that kind of situations, doctor?
So the best example for this is when players have an ligament tear. So, and it's very common in footballers, whereby because it's a lot of twisting and turning movements in football, you are about to have ligament injuries. So once that happens, the player knows, I'm going to be out for a good 6 months, which can impact their whole sporting career. And so it's got to do with a lot of positivity and giving them positive words. Even regardless with the surgery done and the rehab process is done, continuously following up with the psychologists and speaking to them about what is going on in the player's mind is crucial, especially if it's a player from the top leagues, because one, they are under financial problems, they might be having relationship problems and other sorts of problems, whereby they are not able to focus on their sport. So there are a multitude of factors which can affect a player's performance. So and for them to voice out is crucial, because even if it comes with an injury, they know they're injured, and then they have all these factors playing along. So repeatedly going and speaking it to someone, either to a physician or a psychologist, would help them feel at ease again, and also they would feel more motivated to perform better on later on. So when they do start their rehabilitation process, for example a ligament tear, they go to their coaches or their physiotherapists and they are given positive affirmations that they can do better and you will recover quicker and things like that. So they feel more empowered, and then they keep on pushing forward that way. But as for a physician's job is just to monitor how they are progressing. So if they aren't progressing well and they are sort of just at the same level, then probably we would sit together in a room and then discuss on ways or alternatives on how we can strengthen up the muscles and how to work on their agility, their mobilities, endurances, and different sorts of exercises whereby it's comfortable and challenging for the player as well. So they also feel a little more enlightened, and then they feel like, oh, okay, I can do this, I can do that, I can do this. So they feel better that way.
Okay, doctor. So shifting the gear from the injury part and the recovery now, now you're working with a lot of clubs and challenges you're facing, and the collaborating with the authorities and the sports people and trainers. How do you see that, doctor?
So as a sports physician, again, you're in the middle of, you're looking at different groups in a sporting organization. So you have your high stakeholders, you have your coaches, your managers, and then you've got your team players. So having to communicate very well with all of them is essential, and it's one of the most important thing you must have as a skill, because communication is the key. The more easier you're able to communicate with your authorities, your job is done quicker. Whereas if there's something that limits you from talking, then it becomes an issue, because you need to show them the clear picture and the clear idea of what's going on. Because sometimes the higher authorities don't really get the time to speak to players in person until and unless they are like a big star. So they don't have that time or the urgency to speak to everybody. This is for team sports. But for individual sports, again, it comes down to just working with the player, and if he or she has a coach, then you would want to communicate with the coach properly. Try to tell them, right, this is what's happening with your player, this is the condition of the player now, and then what do you want to do with him or her 3 months from now, before the competition or before any sort of event that's going to come by. So having that communication, having the right tone to speak with them, and giving them a clear, brutal, honest ideas of what is going on would really help and benefit everybody. But again, for a medic, the player is the utmost important thing. So whatever the player wants is what the medical team would provide, and whatever they ask for, and the whole idea of having a medical team is just to support the player to excel. So that's pretty much the objective of most of the sports physicians, I believe, I'm not sure. But then that's what they should look forward to, and I think it's the right way to do it also.
Okay, doctor. Doctor, besides treatment and prevention, what are the performance enhancement strategies that you will give it to your sports people who are attached to your clubs?
So for sports players, you usually tend to give them natural foods and a bit of supplements, but then it again depends on the nutritionist who you're working with. So for me, usually I send them to a specialist because they know exactly how to deal with certain things. I also work with them side by side to understand what is going on and whether it's right for the player or not. So when it comes to performance enhancers, obviously there are so many drugs out there which can be a
But
doping.
what I meant was, doctor, the performance, not the drugs or supplement per se, any performance enhancement strategies you will implement?
So for performance strategies, there are very new things that are happening. So one is to do with altitude training exercises, whereby you're trying to work at an oxygen level little bit above the normal. So you basically work in a atmospheric level, probably 2000 or 2500 meters above sea level. The idea is to increase the blood count, and you also get used to that kind of climate. And then when you come back to the normal sea level, you kind of perform better. There are also other certain strategies which the coaches and the other trainers do. I personally don't know much, and I think there are plenty of news out there how you can enhance your sporting events. It all comes down to how you perform naturally, and it's not only about the training aspect, rather you want to think of your food intake as well. So food plays a very important role in your performance, especially each gram of whatever food you take, that counts as an energy level to your body to push more. So depending on what sport the player wants, so if it's an endurance sport, you would want to focus more on carbohydrates and proteins because you're covering a distance of good 42 kilometers or maybe ultra marathons or triathlons. Whereas if you're a footballer, for instance, you would again mix your carbohydrates with proteins because your proteins is your muscle synthetic items. It's a building block. So that helps with recovery and to tone the muscle, whereas your carbohydrates is the energy fuel. So that's what pushes you throughout the games. And little bit of fats also you do need because that's like a storage for when your carbohydrates is over, your fats kick in. So and then you've got your micronutrients like vitamins and zinc, magnesium. So that's all got to do with your electrolytes. So what I'm trying to say is that your food and your exercise go hand in hand. So like I said before, it's got to do with your balance. So it's more like a seesaw. So the more you exercise and your food goes down, there's a problem. And the more you eat and you exercise less, there's another problem. So it should always be balanced that way. And especially with performance strategies, so if you are going to a higher altitude for training, you would want to consume foods which are which keep you warm because they're going a little above your normal body temperature. So you don't want to fall into a condition called hypothermia. You don't want to get your body temperature to go down. So you want to have foods which will warm you up. And likewise, if you're going in a hotter country, you would want to hydrate yourself more and not have a lot of fizzy drinks and things like that, which can kind of limit your performance. So when you are in a season, you kind of follow a very strict rule. But when you are off season, which is like a month or two, that's when you kind of take your cheat meals. Which as a physician is okay because they know that you're going to come back again for your training and you will have to work harder then. So you might as well maintain everything and go.
Fantastic, doctor. Fantastic. Yeah. I think so much of learning. I think I'm like getting filled of all this sports medicine stuff now. Thank you very much, doctor.
No problem.
Doctor, can you share us some memorable moments in your career so far?
So there are like so many memorable events that happen. One of them is when the women's rugby team had won their championships, which is very interesting because especially in UAE, they never had a women's rugby team, and them winning a cup is a very huge thing for me personally because it was my first year when I took up that club, and then they won their cups and championships. And last year the men's team also won, which was my first time I took over the men's team. And this year for the Algerian Arab Sports Games, again it's the first time, and then it was the highest medal tally that the country has won. They've never won that much. So I think because of having a good set of medical teams with excellent and knowledgeable people in it, it kind of helps work with everybody else much more easier and conveniently. And for me personally, I get to learn a lot, and I'm still learning as well, and I feel it doesn't stop. You just have to keep learning, and you kind of learn from your mistakes as well, and then you kind of improve over it. So yeah, there are memorable events that way. And for me personally, I think I don't have any favorites, to be honest. All of this is favorites for me, and I'm just hoping that I get more events to look after this way, and I can show my worth that way. Yeah.
Doctor, advice for aspiring sports medicine professionals.
So advice, I'm not the best person to advise, but then my take on whoever is going to follow this path is that it is something which is fun and interesting, and you learn a lot, but you also want to you shouldn't be disheartened, and you should also feel like you've taken something which you would be proud of. And there are going to be mistakes and downfalls, but all of that is just learning steps. For me personally, I feel like sports medicine is something that I always wanted to do, and it was like a calling for me, so I didn't want to miss it. And it's not something where like a normal physician would say, yeah, it's going on travels and you have fun like that. You do have your fun, but you also have to work, and if you work, you get recognized, and if you get recognized, it adds on to your portfolio and your profile, and also you kind of feel much more relieved to help another player succeed, so it becomes a medal for yourself. So I would say for the growing sports physicians that it's a very good and interesting subject, and it's an upcoming subject, and it's a learning step for a lot of physicians, and you should take it in a positive way and in an open-minded manner, and yeah, eventually you would be happy. So yeah, it's a very nice, enjoyable department.
Wow, superb.
Yeah.
So I think our podcast viewers who are aspiring to become sports medicine professionals might be really happy now after getting all these
Hopefully.
informations.
Yeah.
Doctor, is there anything that you would like to add or share with us which will be beneficial for our podcast viewers?
So beneficial items regarding sports medicine, there are so many other things you learn through sports medicine. It's not only medicine, rather you're going to learn different departments along with sports medicine. So having like I said, having a whole open-minded approach to ideas will just help you throughout your future. Whereas if you stick onto one idea and say that that's the right one, you might not be right. You might make lots of mistakes. So accept mistakes as they come, learn from them, be more open-minded, and also try to learn from other people more than what you study, because that becomes an add-on to your own, it becomes a life skill. So for me personally, I was learning from other departments, more of hands-on skills, because sometimes you do tend to be alone on pitch side. You might not be having your staff members with you. So if you are alone, you need to know how you can manage a player then and there, as and when the injury happens. There are a lot of ways whereby you can approach such injuries, but having that authority and having the mannerism of how you're going to approach an injury is very important, because in a practical world, most of the people are just running around. So when you do have an injury to your, say again, your lower limbs, so if it's a hip or if it's a head injury, you'll have plenty of authorities, delegates just running on the pitch and shaking the player. So you should be very stern with your approach, and you should make it a point that they know, okay, you know what you're doing and you are aware of how the things are to be run. Because again, you are being watched by different viewers. It could be on social media, it could be on televisions, and if they do record some kind of a mistake from you, it becomes an issue. So you want to avoid such issues. So you need to approach in a way that you know what you're doing, and you also know how smoothly and calmly you do it. Because if you start panicking, everybody panics. So you don't want to panic. You want to be very calm, cool, and composed. Then regarding about sports medicine, the physicians also should be fit enough, because they are pretty much a role model for the other people to look. It could be the sporting world or the general population. The general population, again, if a sports physician is healthy, the patient will eventually be healthy, because they are getting advice from a physician who is into sports. And it's not just the degree, but it's also how you look externally. So the more you are comfortable in your skin and you know what you're saying to your patients, they would understand, and they would work with it. Rather, if you're just prescribing medicines and tablets and telling them, right, you can have this and then exercise, that's not the right approach, because the patient wouldn't be compliant enough to have all the tablets that's been prescribed. So they would also want to put in some effort from their side. So education is again important there, and setting examples and setting goals is very important, especially following a SMART rule, which is you're specific with your goals. It should be measurable, it should be achievable, realistic, and timed. So if you know these five ways on approaching your goal, then it makes it easier for the patient also to follow, as well as the physician to just monitor. Rather than just telling them, okay, just go hit the treadmill for like 15 minutes, you're going to lose 2 kilos. You want to break it down so that it's easier for the patient as well. Having also to work with other delegates and dignitaries, whereby giving them ideas on how you can improve the infrastructure of a medical team and what equipments would be needed for the players or for an individual player would be sufficient. And it depends on how you speak to them, and being very crystal clear with your ideas and your take on what can help would obviously help them also to understand, okay, fine, this physician needs such help, so we can just provide them with these supplies. But yeah, I think it's a long journey. It's again a mixture of emergency medicine, orthopedics, and many other departments. So having a hand on everything would be very good. Dwelling into one of them is pretty tough, but then if you're really good in that, then it's good. But then I would say putting a hands on everything and being updated is essential, and it's very crucial also, because if you're not really updated with your ideas and with the recent papers coming out, that can affect your players' performance. So you have to be updated with all your protocols, your consensus, your guidelines, whatever is coming out, it should be at the top. And also trying to portray that out to your community. Speaking about those guidelines to the community can bring a change as well to the community. Doing certain campaigns, doing some talks like how I'm doing here, that would also help.
Thank you so much, Doctor. It's an immense pleasure meeting you. And we're really wonderful to meet a very humble and simple, honestly speaking, a humble and simple sports medicine professional. I'm blessed. I think so much of learning. I'm sure that people who are going to watch this podcast are going to be immensely benefit out of this discussion.
Thank you.
Thank you very much, Doctor, and hoping to see you soon again.
Yeah, see you soon.
Thank you, Doctor.
Thank you so much.
Thanks a lot.
Thank
Doctor.
you.
Thank you.